Welcome to the Bureau of Community and Health Systems video training on feeding assistance for residents with eating challenges in long-term care settings. Let's learn together. What is dysphagia? Dysphagia refers to the collective term for swallowing disorders. Common symptoms include coughing and choking during meals. As many as 22% of older adults live with dysphagia, and 40 to 50% of older adults living in long-term care facilities live with dysphagia. Dementia and dysphagia often go hand in hand. The following are some of the causes of dysphagia. Achalasia, which is a condition that leads to trouble swallowing. Esophageal spasm. Narrowed esophagus. Esophageal tumors. Esophageal ring. Foreign bodies in the body. GERD. Eosinophilic esophagitis, which is a disease of the immune system. Scleroderma, which refers to the development of scar-like tissue. And radiation therapy. Dysphagia is treated through a variety of different methods. The first is through medication. Antimicrobials may be prescribed to treat infections. Lifestyle changes may be recommended. It may be recommended changing the resident's diet and eating habits. Residents may need to eat softer foods that are easier to chew and avoid foods and drinks that are too hot or cold. Other medical therapies may also be recommended. Injections may be prescribed to treat muscle spasms or procedures to enlarge the esophagus or remove an obstruction. A feeding tube may also be recommended if the resident isn't getting enough to eat or drink or is at risk of choking. The following are ways in which caregivers can help make eating and swallowing easier for residents. Pay attention to posture. Ensure residents are in a comfortable and upright position. Keep residents upright for 30 minutes after eating, as this can help with digestion. Have the resident tilt their head slightly forward. Cut down distractions at mealtimes. Ensure the resident doesn't talk with food in their mouth. Serve meals in a quiet environment, using basic utensils, and avoid unnecessary items on the table, as this can help the resident stay focused. Encourage residents to feed themselves. Encourage slower, smaller bites. If it takes residents longer to eat meals, smaller, more frequent meals throughout the day may help. Ensure that all food and liquids have been swallowed before the next bite, and check the resident's mouth frequently to ensure there is no accumulation of food. Additional ways to ease eating and swallowing issues with residents are: use visual and verbal cues. Select dishware that is easy for the resident to see, and give cues to the resident such as chew, swallow, etc. With the direction of the resident's doctor, modify the resident's diet if necessary. Changes to the texture or consistency of the food may be necessary. However, it is important to still try to maintain the look of a normal diet to preserve the resident's enjoyment of food. The resident's saliva management is also important. Have the resident drink plenty of fluids. With the approval of the resident's doctor, from time to time, have the resident suck on ice pops, ice chips, lemon ice, or drink lemon-flavored water in order to boost saliva production. You may need to consult with a speech-language pathologist. You can also discuss feeding options with the resident's physician. A doctor may decide that tube feeding is necessary for residents who cannot eat or swallow safely or need supplemental nutrition. Caregivers could advocate for residents by suggesting to their doctors that they consider rehabilitative therapies for dysphagia. Certain tongue-strengthening exercises and other rehabilitative therapies have shown promise in helping people improve sensory function, chewing abilities, and their safety and efficiency in swallowing. The hope is that these interventions may help slow down the decline of people's swallowing abilities and build their muscles up. Caregivers can assist by controlling the amount and rate of food the resident is eating. Cut food into small pieces and have the resident chew it thoroughly until it becomes liquid in their mouth. Don't let the resident eat more than half of a teaspoon of food at a time. Remind the resident to focus on swallowing. The resident may need to swallow 2 or 3 times per bite. If food or liquid catches in the resident's throat, have them cough gently or clear their throat and swallow again before taking a breath. Also have the resident concentrate on swallowing often. Caregivers can make mealtimes calm and comfortable for residents who have eating challenges. Check the food temperature. Offer only one food item at a time. Be flexible with the resident's food preferences. Eat together with the resident. Keep in mind the resident may not remember when or if they already ate, so you will need to keep track of this. Additionally, there are ways caregivers and dining staff can assist in making meals appear appetizing for the resident. Make the food easy to see for the resident. Consider using placemats and plates with solid, contrasting colors to make food more visible and appealing. Add color to meals. Adding color and plating the food in a way that is presentable and exciting can be enough to entice a resident to eat. Pump up the flavor of meals. Meals that smell great and taste great can boost appetite. You can also add special touches to the meal. Try to make each meal feel like a special part of the day. Recreating the feeling of a family meal where residents are encouraged to talk and enjoy themselves can help with eating. Try smoothies if the resident is struggling with solid foods. Smoothies are an easy way to get fruits and vegetables into the resident's diet. Encouraging independence with the resident can also help if the resident is struggling to eat. Make the most of the resident's abilities. Adapt serving dishes and utensils for the resident to make eating easier. Try serving finger foods to the resident. Have the resident try bite-sized foods that are easy to pick up. You can also try hand-over-hand feeding. This is done by putting the utensil in the resident's hand and placing your hand around theirs and lifting both of your hands to the resident's mouth for a bite. Don't worry about neatness. Let the resident feed himself or herself as much as possible, and don't worry about any messes they create while doing this. In order to minimize eating and nutrition problems, the following should be done. Be alert for signs of the resident choking. Avoid foods that are difficult for the resident to swallow, such as raw carrots. Also, learn the Heimlich maneuver in the event of an emergency. You should also take care to address a resident's decreased appetite. If the resident is eating less, try making some of their favorite foods. Consider increasing their physical activity or prepare several smaller meals instead of fewer larger meals. When caring for residents, it is important to know when to call 911 for a resident with dysphagia. If a resident is having trouble breathing and you think something is stuck in their throat, call 911. If the resident experiences sudden muscle weakness, paralysis, or ability to swallow, you should also call 911. Residents who reside in a long-term care setting will have a plan developed through a collaborative process between the resident, their loved ones, and the long-term care setting. The plan should include assistance with activities of daily living, medication management, how often services are needed, and the equipment or supplies the resident needs. They may also describe the resident's dietary needs and food preferences. The plan is then used as a roadmap for the care team to provide personalized assistance and support. Any challenges the resident may have with eating must be identified in the plan. Any services caregivers provide to address these challenges must also be identified. The Bureau of Community and Health Systems recognizes that caregivers in long-term care settings are an essential part of a resident's care team. Caregivers not only provide physical care for residents, but also emotional support, truly making a difference in the lives of residents and their loved ones. Thank you for taking the time to learn with us today.